Hello everyone. In this video, we are going to look at the difference between acute pancreatitis and chronic pancreatitis. Acute pancreatitis is the diffuse enlargement and edematous pancreas which has occurred suddenly, whereas chronic pancreatitis, the pancreas are shrunken with fibrosis and calcification which has happened over a duration of time with insidious onset. The duration is about days to weeks for acute pancreatitis, whereas chronic pancreatitis can persist for months to years. The pain is severe, constant, epigastric pain radiating to the back and not relieved by posture in acute pancreatitis. In chronic pancreatitis, the pain is dull at the epigastric region and relieved by leaning forward. Acute pancreatitis may be associated with gallstones or alcohol binge drinking. Chronic pancreatitis is usually due to chronic alcohol intake. It may be idiopathic or associated with obstruction. Acute patient has no previous history and episodes of such attacks. Chronic pancreatitis has a history of recurrent episodes. Vomiting is early and persistent in acute pancreatitis. It may be absent or mild in patient of chronic pancreatitis. Systemic features such as fever, tachycardia, shock are present in acute pancreatitis, whereas absent in chronic. Clinically, the patient has a tender epigastrium. There may be guarding, distension, and ileus may be present. In chronic patient, there is mild tenderness, no guarding or distension seen. Lab findings, there is increased serum amylase and lipase about 3 times more than the normal limits in an acute case, whereas it may be normal or mildly raised amylase and lipase in chronic patient. On imaging, the pancreas appear edematous, enlarged, and there may be presence of a peripancreatic fluid. In a chronic case, the pancreatic tissue is showing calcification. There is ductal dilatation as well as atrophy may be seen. Complications of acute patient are shock, acute respiratory distress syndrome, necrosis. There may be formation of a pseudocyst as well as multi-organ failure if the systemic infection is not controlled. In chronic pancreatitis, the complications are diabetes mellitus, steatorrhea, malnutrition. There may be pseudocyst as well as the CBD stricture. Treatment in acute pancreatitis is usually supportive. The patient is kept nil per orally, given IV fluids, analgesics, and the cause is ideally tried to treat. In chronic patient, the treatment is to relieve pain, to give enzyme supplements, to treat any complications that occur, and advise the patient to abstain from alcohol. Let us look at the Ranson criteria of severity. So, as and how these parameters are present, the patient is more serious and the prognosis is bad. So, the age greater than 55 years, a WBC count more than 16,000, glucose more than 200 mg per dl, LDH more than 350, AST or SGPT more than 250, decreased hematocrit, increased BUN then 5 mg per dl, serum calcium more than 8 mg per dl, saturation dropping to 60, the base deficit or bicarbonate increasing more than 4, and fluid sequestration more than 6 liters makes the patient more serious and makes the prognosis more bad. So this is a memory trick to remember acute pancreatitis. A for abrupt finding, C for constant severe pain, usually due to alcohol or gallstone. T is for toxic or systemic features, and E is for an edematous pancreas. In a chronic patient, C stands for chronic alcohol use, H is for history of recurrences, R is relief by leaning forward, O is organ damage either due to diabetes mellitus or malabsorption, N is for a nodular calcified pancreas, I is for insidious onset, and C is for complications such as CBD stricture or cancer. Like, subscribe, and share for more.